Small business owners that I spoke with said already they have these worker shortages and a smaller skeleton staff than they'd really like, and getting them back quicker would be helpful. Meantime, schools have been having these same sort of worker shortages, but teacher shortages. And a few teachers we spoke with said they think this could be helpful not only for staffing, but also for the education of the children.
So I feel like this is actually going to be a step in the right direction, just because it's really difficult when we have to take a 10-day leave of absence to kind of manage like COVID. Not only is that a ton of work for, the educator, but also it's a lot on the students as well.
The CDC's new recommendation is ensuring a quicker return to work, and that will likely mean the recommendations for asymptomatic COVID carriers will be implemented at schools across the country when they return from winter break.
The educators that I have known that have tested positive and that have been kind of like, sitting at home without symptoms, or just like, I just need to get back in the classroom. I just need to get back in the classroom.
And teachers say a shorter quarantine time for students is important for their education too, so they have more face-to-face learning in the classroom.
Our attendance policy is so lax and lenient because of COVID, and we've been making all of these concessions for students because of COVID. So they've kind of gotten away with not having to be in school for a considerable amount of time. So I'm hoping that this will actually help with attendance and actually force students back into school.
The CDC said the science has shown the majority of COVID spread happens early in the illness, typically 1 to 2 days prior to having symptoms and just 2 to 3 days after. The union SEIU Local 1107 represents healthcare workers and public service employees. They told us they do have concerns that any further reductions in the length of quarantine due to increased infection rates could exploit healthcare workers and add stress to a system that is already overloaded, but expect hospitals to implement policies to protect their workers. And a spokesperson for UMC told me that they're reviewing these new recommendations, but have not made any official changes yet. And those teachers that you heard from, they said this could also help with the severe substitute shortage that is happening in the schools. They told me they've been having to fill in more than they ever had before because there aren't enough of the substitutes either. Reporting live tonight, I'm Drew Andre, Fox 5 News, local, Las Vegas.